Okay, Bismillahirrahmanirrahim. In our previous lecture, I have already mentioned that wound is actually a damage to the tissue. And in wound healing, there is a replacement and regeneration of those damaged tissue. And while replacement and regeneration of those damaged tissue, some healthy tissues are formed over the wound, and there are two healthy tissues that are granulation tissue and epithelial tissue. And while in the proper wound healing process, due to some internal and external factors, some dead or devitalized wound tissues are formed over the wound that is a sign of poor wound healing. So, in this lecture, we will discuss those dead or devitalized wound tissue. So, there are many types of, basically four types of dead or devitalized wound tissue. The most common we usually witness is necrotic tissue. Necrotic tissue is known by its name that it's a dead and devitalized wound tissue that is formed over the wound, and it will be more understandable with the proper picture. So, with layers of the skin involved, the dead or devitalized wound tissue varies. If multi-layer or the all of the skin is involved, then there is a high risk of necrotic tissue. Like in this picture, epidermis, dermis, and hypodermis are involved. And while in a proper wound healing process, if the patient does not provide proper care to the wound, and it does not wash the wound, does not cover the wound, and does not provide any moisture content to the wound, then there is a high chance of forming this dead and devitalized wound tissue, which is labeled as necrotic tissue. And necrotic tissue is usually formed when multi layers of the skin is involved. So, in this picture, there is a black and there is a yellow. So we need to understand is that this whole will be labeled as necrotic tissue. This yellow will be known as white E scar. This black will be known as black E scar, and overall will be labeled as necrotic tissue. Necrotic tissue has further two types: E scar and slough. So E scar is usually thick and dry in appearance, and it is usually stick to the wound, while the slough will be moist in appearance by its name, sluffy, moist in appearance. So in this picture, this black thick layer, it is black E scar, and black E scar is usually formed when yellow E scar or white E scar has already formed over the wound, and this moist, little bit moist, is labeled as slough, and overall is known as necrotic tissue. And while in a proper wound healing process, when we modify the internal factors like diabetes, if the patient is diabetic, then the blood sugar level is within a normal range, and controlled level of other body extracellular proteins and matrix and metalloproteinases, that helps in the wound healing process. And the patient takes proper diet, and externally we provide proper moisture content to the wound and properly wash the wound, then the wound heals in a proper manner. And while in a wound healing process, first of all, this black necrotic tissue will be removed through autolytic debridement, then this yellowy scar will be removed, then this whole area will be covered with granulation tissue, and then this epithelial tissue will start progressing towards the center of the wound, and then this wound will be closed. And it takes months, like 2 to 3 months, sometimes 4 to 6 months, depending on the patient internal and external factors. Okay, so this yellow thick layer that is stick to the wound is known as white E scar, and we'll be labeled at it is white E scar. From the point where this white E scar start removing on its own, then the doctors usually cut this left out white E scar and label them as a debridement, known as mechanical debridement. But sometimes the key to understand is that we have to provide proper moisture content to the wound. Externally, we have to apply topical antibiotics with mild 1% hydrocortisone, and then this white E scar start removing from its wound bed, and from where the point it start gets removing from the vein, and we cut it, and then the wound gets open, and underlying this pink layer is actually the granulation tissue, and from the edges the epithelial tissue has already started. So in this picture, this is a black E scar. Here is the white E scar, and from the edges, this epithelial tissue has already started. So, you have already understood that whenever we see the necrotic tissue, it means that multi layer of the skin is involved. So basically, till now we have discussed that in dead or devitalized wound tissue, the most common wound tissue that we usually witness when whole of the skin is involved, it's necrotic tissue. And necrotic tissue has further two types: E scar and slough. E scar is usually thick in appearance, thick and dry, while slough is usually moist in appearance and overall labeled as necrotic tissue. And the key of necrotic tissue is to provide proper wound care through internal and external factors and proper patient stability. Then this wound gets healed in a proper manner. And one of the key point is that my professor taught me is that if we witness the epithelial tissue at the edges, then it means that then the wound wants to heal, like there is a capability of the wound to heal. If we witness the epithelial tissue in the edges, it means that it is a living, it can heal in a proper manner. Okay, the next devitalized wound tissue is scab layer. Scab layer is usually formed in the first phase of wound healing, like there is a mild injury and the blood leaks out over the skin, and we usually cover the wound with a bandage or anything. And if we remove the bandage, this yellow is pseudo scar. It means that patients apply some topical antibiotic or some moisture, and this moisture and this topical antibiotic is mixed up with internal bleeding, and overall formed a scab layer over the wound. This scab layer is usually a dead layer and mixture of dead blood cells, platelets, and debris and foreign particle. And we can avoid this scab layer that we have to wash this respective area with simple soap and tap water. The next layer, the next tissues we witness in wound healing process is callus tissue. Callus is usually a thickened and hard skin that is formed over the wound. Like from this thick yellow layer is callus. It is only a dead skin that is stacked up over the wound, and its only remedy is to wash it properly repeatedly and provide moisture externally to soften, and then to remove it through a simple soap and tap water. So in this lecture, the key to of the point is that we can avoid dead or devitalized wound tissue. Number one, through proper wound healing process. Number two, provide moisture content externally. And my professor usually say that we can provide moisture content through proper Vaseline, through any type of oil, and whatever the patient likes. And this moisture content should be repeatedly applied over the wound, like 3 to 4 times, sometimes 6 to 7 times in a day. And number four, proper wash the wound with a simple soap and tap water. So that's the whole lecture. If there is any question, you can ask it in a comment section, or you can ask me personally. Thank you so much.